Hello everyone, welcome back to our channel. I'm Dr. Ashmita. So today I want to discuss a clinical vignette that is presented as an OSCE chart for the practical examinations of second year MBBS students, also helpful for the postgraduates in pathology. So let us begin by reading out a question, and while reading out, let us decode it one by one with the clues given in the question and try to come to a conclusion. So, a student aged 24 years has severe lower abdomen pain that radiates to the groin. So, there is a radiating kind of pain and it also comes in waves. So, he then notes blood in urea. There's hematuria. There's no underlying illnesses and has been healthy all his life. So, this 24-year student does not have any comorbids, no diabetes, no hypertension, nothing. On physical examination, vitals were normal. Urine analysis shows pH 7, specific gravity 1.020, and no protein, glucose, ketones, or nitrites. So there's no leakage of any proteins, glucose, anything in the urine. Microscopic pictures given below. Here it is attached. And his advice to drink more water. So let us decode it. He's a young person. He has severe lower abdomen pain that is radiating to the groin. This is a classical symptom of a renal pathology or ureter pathology. So lower abdomen pain radiating to groin is classical for this renal colic or ureteric colic kind of pain. So why it occurs and why it radiates to the lower groin? Because whenever there's a pathology, see, whenever there's a pathology in renal, like kidney stones, or there can be pathology in the ureters, this pain, it causes pain that is referred to lower abdomen, groin area, or the testis in males and labia in the females. Labia in the females. Why it occurs is because of common innervation. T10 to L2 supplies the entire kidney, pelvis, ureters, urinary bladder, the groin area, the testis in males, and labia in the minor. All this have a common innervation by T10 to L2. Hence, any pathology in this kidney, any pathology in the kidney or the ureters or the bladder, they give this referred pain to groin area, lower abdomen, testis, and labia because of this. And so it is more in favor. So from this, we can conclude that it's more in favor of renal or ureter pathology. And it is coming in waves. And this is also classical of this ureteric kind of pain. So whenever there's a ureteric peristalsis, the peristaltic pain, it comes in waves. So there could be high possibility of a ureter stone, and the ureter gives out this peristalsis to push the stone down. So in a attempt to push the stone down, the ureter undergoes peristaltic movement, and that peristaltic movement comes out as waves. He then notes blood in urine. So hematuria, the most common cause of hematuria is renal stone or ureter stone. Because of mechanical trauma, the stone impinges on the ureteric walls and cause mechanical trauma to it while its passage during this tract. So blood in urine is highly suggestive of renal stones, although glomerular pathology also is the reason for hematuria, but given this pain history coming in waves, referred pain to the groin, and the most common reason for this hematuria being the renal stones, so it goes, this diagnosis, all the clues from the diagnosis, from the question, it goes more in favor of renal stones or the ureteric stones. Also, he has no other comorbids like diabetes or hypertension. So, any glomerular injury because of diabetic nephropathy or hypertension nephropathy are also ruled out. Vitals normal, pH of 7. The normal pH of urine is between 6 to 8. Anything less than 6 or more than 8, that is acidic urine, less than 6 is acidic. Alkaline urine is more than 8. It favors the formation of renal stones, but renal stones can also occur in normal pH conditions also. Specific gravity is 1.020. The normal specific gravity of urine is between 1.003 to 1.030. So what does this indicate? If it is more than 1.030, it indicates there are presence of solutes like proteins, glucose, ketones, electrolytes being leaked out into the urine. So more the solutes, more the specific gravity. And less like 1.003, it indicates there's more presence of more water than solutes. So any glomerular pathology, any leakage are also ruled out because specific gravity is normal. And see, here no presence of proteins or glucose ketones in the urine. Microscopic picture also attached. So the microscopic picture, it shows presence of certain crystals here. So again, it is more in favorable for this diagnosis of renal stones because the renal stones are formed by accumulation of crystals. These crystals accumulate to form renal stones, and their passage, the crystal passage in the urine, it's like diagnostic of renal stones. And these are envelope-shaped crystals which are calcium oxalate, calcium oxalate dihydrate crystals. The envelope-shaped crystals, like it appears like an envelope here, the square or rectangle almost, like with a flip covering it. So it appears as if it is an envelope, like a box shaped with a cross over it. And also is that student is advised to drink more water. In renal stones, the patient is advised to drink more water because excess fluid intake will cause diuresis, and diuresis will push the stone out. Hence, like that it is highly diagnostic. We have come to a diagnosis of renal stones. Let us begin to solve the questions. What is the most probable diagnosis? Renal stones or ureteric stones? Or ureter stones. This is the most probable diagnosis. Identify the microscopic urinary finding. A microscopic urinary finding shows presence of crystals. These crystals are calcium oxalate dihydrate. These are the calcium oxalate dihydrate. Calcium oxalate dihydrate crystals. These are dihydrate crystals. And enumerate various types of compositions pathogenesis in this disease. So let us see other kinds of crystals. So renal stones are also made up of other kind of compositions. In this picture, the first image shows you dumbbell. These crystals are dumbbell shaped like this, single dumbbell. See here dumbbell. So dumbbell, like it is lifted in singly. By one hand you can lift a dumbbell. So single dumbbell, there's a single dumbbell. So these are calcium oxalate monohydrate. So in an easy way to remember, there's a single dumbbell, single means mono, so there's a monohydrate, calcium oxalate monohydrate. Single dumbbell, remember single dumbbell, you are lifting a single dumbbell. Single means mono, so calcium oxalate monohydrate are these crystals. Dumbbell shaped crystals are calcium oxalate monohydrate. Whereas here we have studied in the clinical vignette, this is an envelope shaped crystal, like boxes, which is a box with a flip covering it, appearing as an envelope. The box with a cross over it. The box with a cross over it. Envelope shaped crystals are, as we have discussed, it is calcium oxalate dihydrate. So to remember in an easy way, di means two. There are two. Generally, envelopes are given like you put a letter in the envelope and pass on. So it is indication of communication between two people. I mean, either lovers exchanging letters. So involvement of two people. Two. Die means dono. So you can see communication between two people is envelope. Envelope means two people. So calcium oxalate dihydrate. Dihydrate means it involves two people. Two people or two lovers exchanging letters. So dihydrate means you have to remember envelope. Envelope is communication between two people. Calcium oxalate dihydrate. This is solved. Coming to the next slide. This here the crystals are like rectangle with a line over it. So it almost appears like a coffin lid. So here coffin. During the funeral, the body is kept in coffin. So it has a lid. So from top it appears like a coffin lid. You can also remember this way. There is a rectangle shaped crystal. This is a rectangle shaped crystals and there are three lines over it like this. Center one line, side there are two lines. So since it has three lines, you can also remember these are triple phosphate. These are triple phosphate crystals, triple phosphate crystals, which gives this coffin lid appearance, coffin lid appearance. Also, these stones, the triple phosphate crystals, they are also called struvite crystals, struvite crystals, and they are made up of. It is called triple phosphate because they are made up of magnesium, ammonium, magnesium, ammonium phosphate, magnesium ammonium phosphate. So mag phosphate, magnesium ammonium phosphate. They form triple phosphate crystals, also called the struvite crystals. And the struvite crystals is the most common cause of this staghorn calculi. In this renal pelvis, it occupies the calyces and pelvis, and it gives appearance of branches of an antler horn, like this branch of an antler horn. Hence, it is also called the staghorn calculus. Struvite crystals give rise to staghorn calculus, staghorn calculus. It is radio opaque. In an X-ray also it appears like this, staghorn calculus, the CT, sorry. So staghorn calculus. On radiology also it appears like a staghorn, branches of an antler horn. So this rectangle shaped crystals with three lines like this. You can remember one, two, three, three. So it is triple phosphate or coffin lid appearance, also called struvite crystals, which give rise to this staghorn calculus. This is about triple phosphate. So this in other slide, these crystals, the hexagonal shaped crystals, the hexagonal shaped, colorless hexagonal, it has six sides, hexagonal. So the hexagonal crystals, they are suggestive of cysteine. They are the cysteine crystals. So cysteine sounds like 16. 16, take the 6, it has six sides. So presence of six sides here, the six sides. 1, 2, 3, 4, 5, 6. The hexagon. It is a hexagon having six sides. Six. So you can say it is 16. 16 sounds like 16. Six sides. So this lamellated appearance. So it is having this lamellated appearance like this. And also it appears almost like a tree bark. It appears like a tree bark. The cut section of a tree bark appears like this, or it has this lamellated appearance. This is seen in leucine crystals. Leucine. So leucine has lamellated appearance, almost like a tree bark. Leucine has lamellated appearance. This slide here you can see certain like it is pigmented, and also here they give like thorn-like from this crystal there are thorn-like projections outside coming out. Thorn-like projections. It appears like an apple thorn. This is the picture of an apple thorn. It has spikes on the surface. So it appears, the spikes on the surface appears like apple thorn. So apple thorn appearance seen in ammonium biurate. Ammonium biurate crystals. Ammonium biurate crystals. A for A. Ammonium crystals have apple thorn appearance. Here in these crystals, they appear like they are like proper square or rectangle shaped crystals, but the edges are broken. The edges are broken here, the edges. So it appears as if there are chips. These are chips with broken edges. So these are the chips with broken edges. Certain chips with broken edges. This broken chip appearance, broken chip appearance seen in cholesterol crystals. Cholesterol crystals give this broken chip appearance. You can remember when you eat chips, your cholesterol rise. So chips cause cholesterol. So broken chips means cholesterol crystals. Next is this slide, long and thin needles, like thin, extremely thin needles. Thin needles are seen in tyrosine. These are tyrosine crystals. You can remember a tire has become thin. So this is one tire. This is the worn out tire. It has become thin over time. So tire thinning, tire, tire has become thin. So it is seen in tyrosine. Tyrosine. Tire has become thin. Tyrosine. So these are long thin needles. Long thin needles like hair strands. They appear like hair strands or needles. So long thin needles sit in tyrosine. Coming to this is bilirubin. These are the bilirubin crystals. How to remember means these are pigmented. Obviously, bilirubin has pigment, brown pigment, and there are spikes. These are also like thin needles only, like pigmented needles. So for bin, you can remember there's a dustbin. But in the dustbin, you throw the wastage and you sweep with a broomstick. The new broomstick, it sheds out certain particles. Like these also appear like brown needles. The shed out particles from a new broomstick appears like long, thin brown needles. So all these are thrown out into a bin. So bilirubin means it has this appearance of this broomstick dust, which are pigmented, which are like brown needles. So brown needles means bilirubin. In bilirubin, in the dustbin, this garbage is thrown, but a newly bought broomstick gives out this brown colored thin needles. So you can remember brown colored thin needles thrown into dustbin, that is bilirubin. Bilirubin has this brown colored thin needles. Next is this round structures almost looking like a car wheel. So these are like round structures appearing like a car wheel. Motor vehicle wheel. This round structures with spikes, certain spikes are also seen. So car wheel appearance. This car wheel appearance. You can remember nano car for it. Nano car is almost round. So car wheel, the round structures suggestive of car wheel. So it is seen in calcium carbonate. Calcium carbonate. In the carbonate, we have a car. So anything related to that, like car has this round wheels, or the nano car itself looks round. Nano car is looking round. So it is called calcium carbonate. Anything like a car wheel appearance is calcium carbonate. And here the crystals have, it is like it does not have specific morphology. So it can take any shape. It can be rhomboid, spherical, so these are rhomboid structures. It can be like rectangle, it can be rectangle, or it does not have a specific shape. So all these pleomorphic crystals. So now not having any specific shape or non-specific shape. So non-specific shape, mostly rhomboid can be seen. Any other structures can also be seen. These are seen in uric acid crystals. So uric acid seen in gout. So uric acid crystals give this appearance of non-specific shape. Mostly we can see this rhomboid or needles or any other flower shaped, any shape it takes. And these are also colorless. So these are all about the other types of compositions of renal stones. If you want, we can revise it again. So the first, here it is this dumbbell-shaped crystals. Dumbbell-shaped crystals are seen in calcium oxalate monohydrate, single dumbbell monohydrate. Envelope, communication between two people or two lovers. So it is dihydrate. Envelope means communication between two people, so calcium oxalate dihydrate. In triple phosphate, it is coffin-lid appearance of the three lines triple phosphate or struvite crystals, magnesium ammonium phosphate, which also cause staghorn calculus that you find on imaging, radiology imaging. So this colorless hexagon, there are six sides means 16. 16 has six sides. This lamellated appearance, lamellated leucine. The apple thorn appearance, ammonium, biuret crystals. Broken chips cause cholesterol. The broken chips cause cholesterol crystals. And this long thin needles, tire has become thin. So tyrosine. Tyrosine has this long thin needles. And this pigmented needles, it is seen in bilirubin. So long thin needles, pigmented brown needles thrown into the dustbin. So bilirubin. So the spikes, the broomstick gives out this while sweeping. The broomstick gives out brown thin needles as wastage. So it is thrown into the dustbin. So bilirubin has this brown colored thin needles. Here the car-shaped car wheel like round the crystals. They are seen in carbonate, calcium carbonate. And any non-specific finding, non-specific shape, colorless shape, they are taken up by uric acid crystals. So we shall discuss the most frequently asked questions during the viva as well. So the most common type of renal stone overall are the calcium oxalate dihydrate. The calcium oxalate crystals, you can say calcium oxalate crystals are the most common that we have placed in the OSCE chart. Calcium oxalate is the most common stone overall. The role of urine pH in stone formation is that the normal pH of urine is between 6 to 8. So pH of less than 6 indicates it is acidic urine. Acidic urine favors formation of uric acid stones, uric acid stones, and pH more than 8. It indicates that is alkaline. Alkaline favors formation of calcium phosphate or calcium carbonate stones. Calcium carbonate, calcium phosphate stones. Which organisms are associated with struvite stones? Yeah, struvite stones are most commonly associated with certain infections, most common in females because of UTI, and this is because of certain organisms that produce protease. The protease producing organisms are this Klebsiella, Proteus, Proteus produces protease, Klebsiella, Proteus, Pseudomonas. So these organisms most commonly they produce this protease. These are the protease producing organisms. They most commonly cause struvite stones because they hydrolyze urea. They hydrolyze urea to ammonia, and this ammonia which is alkaline. It favors formation of struvite stones. Also, struvite stones are nothing but triple phosphate, which are made up of this triple phosphate. Triple phosphate means it is made up of magnesium, ammonium phosphate, magnesium, ammonium phosphate. So coming from this ammonia. So protease producing organisms hydrolyze urea to ammonia. Ammonia, which is alkaline, favors the formation of renal stones, and ammonia is one of the component of triple phosphate, magnesium ammonium phosphate. So struvite stones are most commonly caused by protease producing organisms like Klebsiella, Proteus, Pseudomonas. More common in females because of UTI. What are the radiolucent stones? So the colorless stones like cystine is there, and uric acid. Yeah, these are the most common radiolucent stones. What about radio-opaque stones? Sorry, radio-opaque means they are visible on X-ray or any radiological finding. Like X-rays do not pass through these stones. The most common being the staghorn calculus, staghorn calculus, made up of triple phosphate. Also calcium carbonate, all this, anything related to all of the stones which contain calcium, calcium oxalate, calcium carbonate, this triple phosphate, all these are radio-opaque stones. So cystine, uric acid, these are the radiolucent stones. They are not visible on X-ray or imaging finding because X-rays can't pass through this. Sorry, they can be passed. X-rays can be passed through. X-rays can pass through these stones. They are not visible on X-rays. Radio-opaque means X-rays can't pass through them, and hence they are visible on imaging. So radio-opaque stones are a triple phosphate triple phosphate, calcium carbonate, calcium oxalate. These are the radio-opaque stones visible on X-rays as X-rays can't pass through them. Radiolucent are the cystine and the uric acid stones. And also we can discuss what are the complications, like complications of renal stones. Most common complications of renal stones can be because of obstruction to the ureter or pelvis. It can cause hydronephrosis. Hydronephrosis. Also, because the urine is retained there because of the obstruction, urine is retained, it can lead to sepsis, UTIs, urine tract infection. And because of this, I mean, mostly out is it shows obstructive uropathy. It gives obstructive uropathy. On long-standing obstructive uropathy, it ultimately leads to chronic renal failure. So, what are the measures taken to protect? So, what are the preventive measures? Preventive measures to drink lots of water, like adequate hydration. Number one is adequate hydration. Even in the presence of renal stone, the patient is advised to drink more water as seen in this clinical vignette. So diuresis pushes out the stone. So hydration is a preventive measure. Also avoid certain kinds of foods that have oxalate. For example, a patient is prone to calcium oxalate stones, that struvite stones or calcium oxalate stones. You avoid foods or diet rich in oxalate diet. So oxalate diet should be avoided. What are the oxalate diet? Oxalate rich diet like nuts and seeds like groundnuts, cashews, almonds, seeds like sesame seeds, then nuts. Among the vegetables, spinach, beetroot, and even the okra, bendi. All these are like oxalate containing diet. So these can be avoided in patients who are prone for this calcium oxalate diet. These are the few preventive measures that can be taken. Thank you, everyone.